Hi, my name is John Wyrick, and I'm the Superintendent of Schools for USD 506. I'm here today to talk about the Test to Stay and Learn plan coming to USD 506 schools this school year. The Test to Stay and Learn plan allows us to test close contacts daily during their quarantine period with the goal of keeping close contacts who are negative on-site and in-person learning. For quarantine purposes, close contacts of a case of COVID-19 are still defined as anyone that has been within 6 feet for 10 minutes or longer.
Hello, my name is Shane Holtzman. I'm Assistant Superintendent for USD 506. Voluntary participation in this testing strategy effectively reduces the need for close contacts to miss in-person school after exposure to a case. Only close contacts who are wearing masks are eligible to remain in school during their quarantine period under this testing strategy. Testing will take place at all USD 506 school buildings. In order to be tested, there are a few items that we need to take care of first. Number one, you must have a signed testing consent form. For students under the age of 18, a parent or guardian must sign this form. This form can be found on the website at usd506.org. Staff and students must be symptom-free and in good health to be tested as well.
Mr. Holtzman, I have a question for you. What if my child is exhibiting symptoms of COVID-19? Can they come to the office to be tested?
Dr. Wyrick, unfortunately, no. The rapid antigen test we're using in USD 506 will not be used as a diagnostic tool for students. Students will be screened for symptoms prior to testing. Parents of students who are exhibiting symptoms are urged to contact their child's healthcare professional for further evaluation and possible diagnostic testing. Students who have family members who are symptomatic and are awaiting COVID diagnostic test results are urged to stay home.
Could you please explain to me what does the testing protocol or procedure look like if my son was a close contact?
Dr. White, the person administering the test will be wearing personal protective equipment or PPE. This will help keep them safe while performing the test. PPE may include gloves, a face shield, a gown, and/or goggles. Please keep in mind that the PPE worn may be different depending on the person testing. With us here today is USD 506 Board Member and Vice President Dr. Colette Smith to demonstrate the testing process for us.
As everyone can see, I'm in some form of what we call personal protective equipment. The person doing the testing at all of our locations will have similar but may not be exact PPE on. You will find that we will have some type of eye protection, whether it's goggles, glasses, or a face shield such as this. We'll have some form of mask, gloves, and then a gown. Again, it may not appear exactly like this, but we wanted you and your child to see an example of what we may be using. Mr. Holtzman, now we're going to demonstrate sample testing. This is a sponge tip applicator. It is much smaller than your normal Q-tip or cotton tip swab. It's very flexible and it's not rigid at all. This only needs to be introduced into the nair and not go high as some other forms of testing are done. It's intended to be painless. It may tickle your nose and oftentimes you might sneeze afterwards. Mr. Holtzman? As you can see, the applicator just goes into the nose where the sponge stops. We rotate it around 5 times. 3, 4, 5. We take it out and we do the same in the other nostril. 1, 2, 3, 4, 5. Mr. Holtzman, do you feel like you want to sneeze? Does that tickle a little? And that's the testing portion for your child. Then we do different types of, we add a reagent and it goes onto the card. The card, then we slide the cotton tip applicator sponge stick into the card. We go in here, we peel this adhesive back, We simply secure it and we wait 15 minutes for the results.
Mr. Holtzman, when will we find out the results of the test?
Well, Dr. Wright, it's a good question. Just a reminder, your child must test negative for them to return to class that day. However, if your child tests positive, we will notify you immediately. Once the swab is complete, we are waiting for test results. You'll be asked to remain in a designated area until results are ready.
Thank you. If you have any questions, please feel free to contact your child's building principal. Mr. Holtzman and I are looking forward to a healthy and safe start to the school year, and we are excited to be serving the students and parents of USD 506.